Good afternoon, everyone. Welcome to Advocacy in Action. We're excited to bring some other AOPA team members to the webinar today. I want to welcome Joy Burwell, AOPA's Director of Communications and Membership, Nicole Verkeilen, our AOPA's new Manager of Public Engagement. You know me, I'm Ashley White, AOPA's Health Policy and Strategic Alliances Director, and Sam Miller, who is AOPA's Manager of State and Federal Advocacy. So you've got a full slate of AOPA team members on the webinar today, and we're really excited. I'm going to kick it over to Joy to present the strategic priorities that are associated with our webinar today. Go ahead, Joy.
Hi, everybody. It's usually I am just behind the screen, so I am excited to, well, sort of excited to be here on the screens. I actually like being behind the screen, but it is good to be here with you all today. On your screens, hopefully you will see what we will soon be officially launching as AOPA's new vision, revised mission, and strategic priority areas for the next 3 to 5 years. This is a result of the strategic planning process that the board undertook late 2021, which hopefully a lot of you completed a survey that we sent out or participated in phone calls and, you know, or just any provided feedback throughout the year that was also incorporated in this process. And through this process, we came to find out that AOPA didn't have a vision. I think or a defined vision. I think we all have a vision. We just didn't have it on paper. So as a result of this, we have established this very engaging and dynamic and inspirational, a world where orthotic and prosthetic care transforms lives. I think that's what each and every one of our members do day in and day out. It's why you guys get up, certainly why I get up to help you all. With the mission, the board tweaked it. It was always through advocacy, research, and education, you know, AOPA, blah, blah. Well, we better defined it. We put a little more meat to the bone to help better articulate what it is that you and AOPA does. So I won't read it, but you will see that and come to hopefully appreciate and know that that is what we are doing day in and day out here as AOPA staff for our members. Now, while we're all here today, is to talk through the first strategic priority area. The rest, I think AOPA has been doing to a for a while, but we're doubling down and going to dig in and do them even bigger in the next 3 to 5 years. But the first one is something that we had never fully invested in because we were limited from a staff perspective, whatever, resource perspective, whatever the case may be. But we are now invested in communicating the importance of orthotic and prosthetic care. So where does that start? That starts with telling the story. We all have a story to tell, and that is why we have hired Nicole Verkeilen, who I'm sure many of you know, to be our Manager of Public Engagement. She's going to talk a little bit about what it looks like to tell your story from an advocacy piece. I think every story that we all have to tell is connected to advocacy, and it gives us that opportunity to drive home some of these big legislative and regulatory asks that we are digging into. So with that, I'm going to stop and turn it over to Nicole.
Awesome. Yeah. Thanks everyone so much for joining. It looks like we've got some good attendees on here. Want to give a shout out to Toddy again. I see you're out there. So thank you guys so much for joining. Yeah, my name is Nicole Verkeilen. I'm AOPA's new Manager of Public Engagement, and I'm so excited that AOPA is launching this new initiative to focus on telling the story of O&P. And as a prosthetic user myself, an amputee for the past 20 years, this is something that's near and dear to my heart and the work that I've been doing as an advocate over the past 5+ years. And that really only kind of started because of being able to understand what my story was. But before I dig into kind of my story, I just want to quickly just go over and emphasize the power of storytelling and why we tell stories to begin with. I think most of you probably can relate to the power of storytelling, whether you're an advocate or a lover of watching documentary films or just film in general or movies or reading a good book. I mean, we all love what a story can do to change our lives, to motivate us, to empower us. And that's something that's so important to the work that we do in healthcare as well, to be able to tell the stories of our patients And not only that, but the stories of our healthcare providers, our heroes that are behind the scenes, working day in and day out to transform people's lives. And, you know, with the Olympics going on right now, I just want to use that as a timely example, the Olympics and Paralympics. But, you know, watching a sports program, you see the athletes out there, but once you know their stories and hear their background of Aaron Jackson or Michaela Schifrin or Shaun White, once you know who those people are, you're so much more excited to watch them and to root for them and to cheer them on. And it's what brings you back to watching. And I don't know if any of you guys were rooting for Michaela Schifrin last night. She's been going through a major challenges of her own, but I was rooting her on. And even when I saw her interview with NBC, you know, I wanted to be able to reach out to her and say, hey, like, can we get her access to some therapy or some other athletes? So that's the power of what a story can do. It motivates you, it emotionalizes information, and it compels you to act. So if that's not convincing enough about what, you know, the power of a good story, I will kind of share with you my own story. So it was back in 2017. I was working in alumni relations and annual giving, kind of fundraising sphere, but also marketing and communications world background as well. And over the course of, you know, working there, I was in the process of running my first half marathon with one of my really good friends, and my prosthetic leg just kept breaking. I only had one prosthesis, just a walking leg, having lost my leg to bone cancer when I was 10 years old. Only had the one prosthesis, was never able to get access to an activity-specific prosthesis. And through the course of training for this half marathon, you know, I'd be going 2 steps forward and just one step forward and 2 steps back every single time because the prosthesis just kept breaking. And, you know, went to my prosthetist, ended up using all of my sick time, had like 26 appointments over the course of a year trying to figure out what we could do, what prosthesis would be able to be covered by my insurance, but allow me to be active. And in the meantime, I'm, you know, playing softball, playing all these other activities, doing other sports, and had some of my teammates come up to me and say, hey, like, can we see your other prosthetics? Because they had seen in the media other individuals with running blades and access to these more advanced prosthetics, and asking me, hey, you know, and you know, can we see what else you have? And that's when it really occurred to me, like, wow, this is an issue, and I have a story to tell here about what's going on in my own personal life that's not hitting the media and that other people don't know. And so what we decided to do was to kind of frame a story of wanting to take on the biggest adventure and athletic event of my life, doing a 1,500-mile triathlon down the West Coast from Seattle to San Diego, all on my walking prosthesis. And really the biggest question wasn't if, you know, I had the willpower or the stamina or the energy to do it, but it was whether or not my one prosthesis was going to survive the journey. And because of that story and that narrative that we had crafted, we were able to attract some documentary filmmakers to come with us and to document that journey down the coast. And, you know, I don't want to give anything away because there is a film that you can go out there and watch called 1,500 Miles. But yeah, my prosthesis did break during the course of that journey. And it wasn't the fact that, you know, I had the willpower and drive to do this, but it was really the lack of access to prosthetics that kept me from being able to live my best life and having the same opportunity as other individuals. So that story and what we created out of that was Forrest Stump, and we're able to get some attention from some great, from AOPA, from a whole host of media. And if you can see the sign behind me, Tom Hanks signed a poster for us, says "Run Nicole Run," in a nod to Forrest Gump with the Forrest Stump journey. But really what the point of that whole story and that whole narrative was is how can we inspire action? How can we challenge the way that we're thinking about this? Because when we first started out, people were just assuming like, yep, this is how it's always been. It's never going to change. And, you know, now we're to the point where, hey, we think that we can take some action on this and move this agenda forward. So there were definitely a lot of things that I learned along the way of telling my own story, and even with the documentary film, that I want to get across here with all of you in terms of telling the OMP story. Because I'm sure on a daily basis, you might see something in the media, and now more than ever, There are commitments from companies, corporations, organizations for diversity, equity, and inclusion, and so many more people with disabilities are showing up in ads, in company video assets, and how they're selling their products as well. And that's something that I've been a part of myself, joining certain brands and having them using my story to help them relate to their product. But something that's missing throughout all of that are the individuals behind the patients. And that's definitely something I learned when we were creating 1500 Miles, the film, for example. Our documentary film crew had a really hard time understanding, you know, what is a prosthetist? What does a prosthetist do? And for the sake of this short 15-minute film, what they ended up doing was referring to my prosthetist as a mechanic. And looking back on that film now, knowing what I know and the position of AOPA and kind of the issues that we're dealing with now, I understand that that was a problem, to refer to Natalie and my prosthetist as a mechanic because of these broader issues within policy and advocacy to try and get O&P viewed as a real healthcare service beyond DME. You know, I think Nat definitely prides herself as being a mechanic and also a clinician and also an artist. And there's so many professions that are wrapped up in one, which is what makes orthotics and prosthetics so amazing. But we have to be really careful about how we talk. Something I want to get across to you all today is how can you make sure to learn from these examples yourselves and better communicate and help tell the O&P story. Another example within 1500 Miles, kind of towards the end, when I was taking the film out and sharing at different film festivals and have questions from the audience. You know, this one question that came up, it was at an ISPO conference in Hawaii. Someone asked, you know, hey, did you have any sores or issues with your socket, you know, after 1500 miles, 2 months? And I said, no, you know, I didn't have any issues. And they, you know, responded and said, wow, what an amazing job your prosthetist did. And I think that was so important because that wasn't really in my talking points. And, you know, it was really focused on the journey, it was focused on the adventure. But I think it's so important to give credit to our prosthetists and orthotists that are out there, because that is pretty amazing to have a socket after 2 months, 1500 miles, you know, not having any sores or issues. And since then we've duplicated, you know, that socket, and here I am wearing a prosthesis now for the past 4 years, and it fits beautifully. And I think that's something that goes unrecognized, and we want to make sure that our prosthetists and orthotists can generally be a very humble group of people. They want to be behind the scenes, but we got to help them and help ourselves be at the forefront and take some credit for the work that we're doing, and in being that partner, and not in an ego type of way, but just being part of that story and making sure that we're part of the story. And another example that our group had kind of talked about, you know, some of the Visa and Toyota commercials that you guys are seeing right now in the Olympics and Paralympics. You know, you see individuals with disabilities using prosthetics, orthotics, wheelchairs, you name it. But most people don't understand who are the people behind them, who are the ones that are ensuring their care, who got them to that point. And that's the story that we want to make sure that we're telling. And that's something that AOPA is committed and working to tell as well, but we're going to need your help. I will share some successful examples of things that we've seen in the media so far, and would love to have you guys look those up. So for example, there is an article, MSN, Yahoo, of Joe Barrow found and thanked his physical therapist right after AFC title win. Hopefully I said his name correct. I'm not a huge NFL fan, but okay, cool. But that's huge. I mean, to have something like that in the headlines, that he, right after his AFC title win, he went and thanked his physical therapist. Let's get some more media around that with our prosthetists and orthotists. You know, there's another article about Shaun White's physical therapist and him detailing the challenges that he's gone through and how he helped him get to the Olympics this year, his last round, which is an incredible story. And then there's another one in the Washington Post with Alex Smith's return to the game with a custom leg brace that Hanger has been able to share. So all of that's so important and hugely successful to have those types of media. But we want to expand upon that and do more in that area. So what this all means for you in terms of, how you can help, we're going to be calling on you to help us. We want to have more video assets and stories from our members, from the ground, having you guys reach out to us and telling us like, hey, I've got this amazing young individual, and this is what they've gone through. For example, Bill Crocker at OSER recently reached out to me about a young woman named Hannah Sivankara and some of the issues that she's been going through trying to get into becoming a nurse with the Navy Corps as a below-knee amputee. And that's something that we want to help her with, and seeing how that's related to advocacy as well. But every single one of your patients has a story. Not all of them have to tell it. We don't want to push anyone to tell a story that they don't want to tell, but if there are individuals that you feel have a really strong story that relate to these policy positions or the advocacy work, we want to bring them to the forefront, and we want to make sure that you are part of it, and making sure that the prosthetist and orthotist and the manufacturer and really their whole care team is part of that story too, so that we can really get that across. The other thing that we want to emphasize is that you can just do your part locally too. It doesn't have to be in this national sphere, but whether you're an admin staff, whether you're a prosthetist, whether you're a technician, no matter your role, you can educate individuals about the work that you do. Sharing these videos like the Toyota and Visa commercial and saying, hey, this is the work that I do. This is exciting. I'm helping people like this, so that we can start changing the narrative and helping people see behind the scenes of what's happening to get these people to those start lines, to those finish lines, and standing on the podium. So that's what we're here to tell you guys about telling the O&P story, and we're really excited for this initiative. And I want to open it up to the rest of my colleagues to share something, and also pass it over to Sam to continue sharing how important that is.
Awesome. Thank you, Nicole, for helping us understand the importance of storytelling and for sharing your story with us. That's really inspiring and helpful to contextualize everything. To kind of add to your point about telling the story for this kind of the sake of advocacy and helping others understand this kind of clinical care component that's so important with O&P. Recently, late last year, we had Jeff Brandt, an AOPA board member. He visited DC for several Hill visits at offices of a number of members of Congress, and he was able to tell stories of the challenges he faces and his successes, kind of the day-to-day work that he does in the field. And actually, we met with a couple offices, and by the end of the day, or within the next few days, we had some commitments for co-sponsorships to the legislation that we're working on at the federal level. So you can really see how that has an immediate impact. And congressmen and women see numbers every day. They see statistics, and they work with a lot of that on a regular basis. But telling that story and having a face to kind of the issues that our field are dealing with is very important. So I think that telling that story is absolutely vital when it comes to advocacy at all levels, whether it's federal or state.
Yeah, Sam, that's such a good point. And I know I've probably said this, so I apologize if you've heard me say it before, but Sam was such a rock star during those meetings with Jeff Brandt, because it was his first in-person meeting. So we've been doing a ton of Zoom meetings. We've done nearly 100 since May, or over 100 since May. And so many of those have been on Zoom, but this was Sam's first in-person meeting with Jeff Brandt, a board member, and a member of Congress walks in to the meeting. And so, it does make a big difference. That member of Congress showed up for that meeting, not because Sam and I were there, but because Jeff Brandt was there, and he was his constituent, and he was going to tell the story about the work that he does and that his company does. And so it makes so much of a difference to have that voice in the room with us when we're doing this advocacy on your behalf. And there are all types of ways that Nicole described, some of them, that we can kind of like pave the way so that there's a better understanding of that story by the time we get there. By the time we make our ask, we've laid the groundwork, right, for them to understand that there is somebody behind the scenes that's making it possible for this grandmother to return to her community center, for this person to return to their activity or sport of choice. All of that, it's really important to show how we got there. We start somewhere, and where we're starting is not access. And the whole point of our advocacy is to change that moment of access. And so it's access to the prosthetist too, right? If you can't provide your patient with what they need, then you're not going to be able to help them see a new normal or a new day. So I'm really excited that we have such a awesome team here working on this new strategic priority. And something that Joy said that kind of triggered for me also, it's not that AOPA didn't realize we needed to tell the story, it's that we didn't realize that people weren't hearing it the way we were saying it. I mean, we didn't realize how much we needed to prioritize and put the care provision concept into focus. And again, I'll apologize if I'm repeating myself, but someone said once that prosthetists so easily see the impact that they make with their own eyes that they can't talk about it. And I think that's really true, right? A patient will come in their wheelchair into your office, and then they walk out, and you're like, we did that. That's what I'd come to work for every day. But then having to try to tell the world that sometimes feels self-centered or egotistic, and it's not. It's literally what you're doing. You're literally helping people walk outside of your facility. So we have to keep saying that. We need to be, screaming it from the rooftops. And so excited to have Joy and Nicole putting their energy into this work, and it's going to make our advocacy efforts so much more impactful. So thank you all. I think now we can turn it over to Sam for the announcement of the Advocate of the Month, and then we'll take some questions. So everybody stick around and send us some questions.
All right, so the moment you've all been waiting for. Advocate of the Month for February 2022 is Arlene Gillis. Congratulations for your work with the Phone to Action or Capital Canary software, but also Arlene helped arrange a visit of O&P students to the Florida legislature, and that is something that's very impactful and raises the visibility of the profession quite a bit. So really appreciate your advocacy efforts, Arlene, and we will be in contact with you about your prize. Thanks.
Thank you, Sam. And so we want to take some questions, and we'll encourage you all to ask questions about, anything about AOPA's new vision or mission or the strategic priority, ways that we want to engage with you all, questions you might have about that. So please feel free to ask questions if you have them.
I actually have a really quick question.
Oh, go for it.
The policy forum.
Ooh, thank you. Yes, plug away, Ashley. That was my job, my fail. Here we go. So one of the things about this, the story that Sam shared, how impactful Jeff Brandt's visit was in DC. Everybody can be part of that, right? So we encourage you all to come to DC. We will set up those meetings for you if you happen to be in DC and you want to engage with us. But more importantly, everyone's going to have opportunity to do this during the AOPA Policy Forum, which will be held May 17th and 18th. So put that on your calendar. Look on our website. We're sharing lots of promos around it. But yes, definitely, we invite you all to join us in DC. We have on good authority that things will be opening back up in May. Fingers crossed. We will absolutely be paying attention to all of the COVID restrictions and all of the necessary precautions that need to be taken. But it's looking like trending in the right way, and we're hearing encouraging news from congressional offices that they intend to open back up. So we're very excited about May and hope you all will join us. Thank you, Sam.
Registration will probably open, if not next week, the week after, as well as we'll have all the hotel information up then on the website as well.
And I will share, after our journey down the coast, we knew, you know, the first thing that we needed to do was go to DC. And so the first opportunity we had was being invited by AOPA to join the policy forum. And that was my first experience being able to go to the Hill, and it was amazing. And I definitely got hooked after that, just being able to go into members of Congress's offices and being able to speak with them, and you know, doing some tactics that at the time I didn't realize they were tactics. I was just trying to share my story, but you know, taking my leg off, handing it across the table to really showcase, you know, the importance of the care and to be able to have them remember us at the end of the day. So I would urge everyone to be part of that. I mean, we are a small profession in many ways, but we can make a large voice and a loud voice by coming together.
So we do have a question from Lindsay. She asks, is AOPA looking for videos of patient testimony that highlight the prosthetist role? And if so, where can we upload those or send those? I think we are working on a platform to collect those. So we will be in touch and you will be hearing a lot more about those. But to answer your question, yes, we are, and we will be providing that outlet in the very near future. But we're glad that seemingly means that you have some, which is great, because we figured a lot of our members do, and if they don't, we will have an easy way to get those so that we can get them and then use them.
And we will boost your socials. So
yes.
If you're sharing stories about the prosthetist in your office, you know, whether it's an opportunity to chat with one of your patients about how their rehabilitation has progressed or something like that. I mean, anything that you can think of that will highlight the work that you're doing. We recognize that the patients have incredible stories to tell themselves, and so a lot of times you'll see the end result. You'll see the patient out in the community, or you'll see the patient even in the parallel bars. But we don't always see the prosthetist working with the patient, or the orthotist fitting the brace. We think that might be beneficial as well, just so that people understand what's happening, what's actually occurring. You can imagine, you know, there's so many like hospital TV shows or medical shows, right, where the surgeons in the operating room doing the work that they do, and so people have seen it so many times. But I mean, how many times have people seen a prosthetist, you know, fixing the alignment on a prosthesis, or an orthotist, expanding an AFO for a patient because they've changed shape or something. I mean, the idea that there's so much work happening, but that's all behind the scenes. I think we got to bring that behind the scenes stuff out to the front.
Yeah, and I think historically, I mean, even just kind of putting my patient hat on, it wasn't even until the past few years that I even understood what happened behind the scenes, because I would usually be sitting in the patient room and, you know, for a few hours, because that's how long these appointments take, but I never knew, you know, what's happening behind the closed doors. But having that opportunity to come back and see the work that's being done, I mean, it's amazing. I think there are a number of clinics who've tried to kind of flip that model on its head by bringing that space out in the open so people can see what's going on, like the Limb Lab in Rochester, Minnesota. Other clinics who've brought all the patients into one room, which now with COVID could be providing some challenges, but the experience of having everyone in one space is incredible. So even just thinking about, you know, how can you build ways within your clinic to make sure that there are more interactions, and some of bringing that some behind the scenes to the forefront that could then help us be able to tell this story down the line, I think is really important. And I will plug a story where at the National Assembly, I was up on stage and I was having a conversation with Representative Eric Paulson, and was sharing a story about an individual that I had met named Kim, who was in New York, and she had been running and doing an ultra marathon, 300-mile race across Southern America. She ended up being hit by a car during that race and lost her leg above the knee. And she's a labor and delivery nurse, which requires, you know, standing on her feet for hours on end, you know, very physically demanding job. And so her prosthetist, and her physician had recommended that she get access to a microprocessor knee, and her insurance denied her access to that. Then they denied her access to a hydraulic knee, and she ended up with a mechanical knee. And then she ended up switching prosthetists to get access to what she needed, as we all know. But that process went on for over more than a year. And as I was sharing that story, it was after the assembly that her prosthetist, her new prosthetist, who's fighting for her and has now gotten her a microprocessor knee, came up to me and said, "That's my patient, that's Kim." And that was incredible. I was like, where, let's get you some media with the New York Times, like, let's, because Kim had been featured on the New York Times, and let's make sure that you're part of that process with her. You're part of this team it's pushing her forward. So that's something that we have to remember. So if you have a patient like that, and you want to help be part of the story, reach out to us, and we'll help kind of coax those stories out too. I don't want you to feel like you have to have the whole story worked out and all the video and photo elements done. That's something that we can help you guys with, to tell those stories.
I think we've given people a lot to think about, and hopefully exciting. And we are, as you can tell, we are all excited. So I can only imagine everyone else is very excited as well. And we hope to see everybody in person and their excitement in person here in 3 months. Is it 3 months? 3 months. Yeah.
It is. Yeah. I want to do a final plug just for this webinar series. We've been, I think, to be fully transparent, we've been surprised at the low turnout. And I don't have any ego about that. I want to make sure that our message is getting out there. So if you have colleagues that you think would be interested in these topics each month, please let them know about the Advocacy in Action webinars, or share this on your social, or share it with your LinkedIn and your colleagues, because I think having people hear this and hear the importance of it, and hear how we're trying to bring forward the clinician's story, I think would encourage others. And so we'll be referencing back to this strategic priority pretty much every single Advocacy in Action moving forward. We're going to kind of highlight and hit on it constantly. So you'll be hearing a lot about it. It'll get boring, but we need the message to spread. So please invite your colleagues to this webinar series. And we're going to be figuring out ways to reach you all and your colleagues as well. So that's on us to make sure that we can engage more clinicians and front office staff. But we are so thankful to those of you that joined us today. We did have a good turnout, so thank you all. And congratulations again to Arlene. And I will close us out unless there are any final questions.
No final questions.
All right, well, thanks everyone. Have a wonderful rest of the week and a great weekend. Bye-bye.
Thanks everyone.